the original communiversity. This is The Front Page on Radio Free 102.3 KJLH.
Cause when words come to worst, my peoples come first. So if you ain't busting down, please disperse. Please disperse. Please disperse. I knew I never.
Radio Free 102.3 KJLH. It is the Front Page special Saturday Town Hall edition, brought to you by the Independent Professionals Association at indywork.org. That's INDY work.org. The City of Los Angeles Community Build and Council President Emeritus Herb Wesson. So pleased I got a chance to speak with the Surgeon General of the state of California, the first ever Surgeon General for our state, also happens to be an African-American woman.
Dr. Nadine Burke Harris, she's an award-winning physician, a researcher, and advocate dedicated to changing the way our society responds to a serious crisis of our time, which is childhood trauma. She's also the first ever Surgeon General in the state of California. Dr. Nadine Burke Harris, welcome to the Front Page.
Thank you for having me.
Well, thanks for coming. It's been really inspiring. I'm reading about you, learning more about you. I myself are from the Bay Area, and your discoveries and research around this whole issue of childhood trauma really start in the Bayview Hunters Point area of the Bay Area, San Francisco.
Yes, that's right. When I finished my residency training at Stanford, I wanted to work in a place where I felt like I could give back to the community. And I had, spent much of my time in medical school and residency focused on addressing health disparities. And I also did, took time after medical school to do a master's degree on public health, really focusing on community health and how we can address health disparities in vulnerable communities. And so that is why I came to work in Bayview Hunters Point. And it was really there that I learned about the profound impact of early adversity on our health throughout the lifetime.
What I loved in your TED Talk, you really break down that this is not, this is not airy-fairy, this is not opinion, this is hard science, that these childhood adversity experiences actually affect the brain.
Yes, that's right. So if you think about it, when we experience something scary, right, what happens in our brains and bodies? Well, it turns out the part of our brain that, senses fear is, it's called the amygdala. It lights up. It sends signals to the entire brain and body, and it causes our brain and body to release stress hormones like adrenaline and cortisol. And these stress hormones have an impact on the way that our brains function. They impact the way our immune system works. It impacts the way that our hormones work. And all of that was designed to save our lives if we are walking in the forest and we see a bear, right? It's designed to activate our whole body so that we can respond in that time of stress to really be life-saving. But the problem is that when that biological process is repeated over and over and over again, it goes from being adaptive or life-saving to health-damaging, right? And that is what we see for folks who have experienced a lot of adversity, especially during childhood, because during childhood, we know, right, that's when our brains and bodies are just developing. It's like the old Frederick Douglass saying, it's easier to build strong children than heal broken men, right?
Yeah.
And that's really why particularly the impacts of significant adversity in childhood has a greater impact than when we have those same exposures later on in life.
So now, Dr. Burke Harris, fast forward to 2020, California, and here we are in the middle of this crisis of COVID-19. could what you're talking about as far as our early adversity, could that be one of the reasons why African Americans are seeing so much more deadly outcomes with this coronavirus pandemic?
So we think that it's certainly very likely. The short answer is yes. What we are seeing is that when we see African Americans having a higher rate of death as a result of exposure to COVID-19, there are lots of reasons for this. One is because we're more likely to be exposed. We're more likely to be in the service jobs that are, essential right now to keep our, keep everyone's lives going. Things like bus drivers and grocery store attendants and all of that stuff. But we also recognize that the impact of cumulative adversity, right? All the adversity that you experience over your lifetime, and these include not just the specific, adverse childhood experiences that researchers at the CDC studied, but it also includes the impact of adversities like discrimination. These experiences can get under our skin and change our biology, and they can, number one, increase our risk for the chronic diseases that make COVID-19 worse, things like heart disease and kidney disease and chronic lung disease, right? So we see the more exposure to adversity someone has had, the more likely they are to have those conditions that put you at high risk. But also we recognize that it can, this high level of adversity can also affect the way that our immune system functions. And so we're really looking hard at that to try to better understand why is it that we're seeing these disproportionate impacts in our African American community.
And, I talk to African Americans, to our people every single day on the radio. That's my job for years and years. And by the way, family, just to put it in context, Hunters Point is probably equivalent to like Watts if you were in LA, a similar kind of neighborhood. But there's a lot of people that I'm hearing from that just don't believe this. They feel like, well, maybe we're just being scapegoated and told that we have higher numbers of African Americans who are affected by this, but it's really not bearing out in the data. Can you speak to that?
Yeah, I think it's actually the opposite. I think that when we think about the notion of scapegoating, right? It's around blaming the individual for this trend that we're seeing, when really what the science and research tells us is the opposite. The fact that we are seeing increased death rates among African Americans from COVID-19 is undoubtedly due to generations of decisions, practices, and policies in which we as a society demonstrated, made choices about whom we prefer, right? And so when we look at policies like redlining that concentrate African American communities in certain places because African Americans were barred from owning property in certain areas, when we look at the underinvestment in resources, in infrastructure, transportation infrastructure, all of the above in African American communities, it's the definition of disenfranchisement. But the point here is that these decisions result in increased risk for African Americans. So when we see these higher rates, for myself as a public health practitioner and as a representative of our government, listen, I recognize I didn't make those choices. I didn't write those redlining policies. But as a representative of our government, I represent a government that did. And it is not enough for us to say, right, that these things happened. We have to look at putting the resources and investments into place to undo those harms.
Yeah, it's well said, and it's a tall order, isn't it? Especially in the middle of a pandemic.
Yeah, well, it's never going to happen overnight, but it starts with the acknowledgement and the recognition. Because here's the thing, when it comes to the data, if we don't measure it, for all intents and purposes, it doesn't exist, right? If we don't measure it, we can't remedy it. And so that's part of the reason why I think this data is so important, because it stimulates us to be having these conversations. But even just yesterday, I was sitting down in a meeting with Governor Newsom and our Director of Public Health, and as well with leaders in the African American community. We were having a conversation, and we were talking about the urgent need to bring more testing into our communities of color. Right? So when we look at, for example, the CARES Act that supported free testing, right? Free testing, from the federal government. That's fantastic. But most of that free testing is happening in hospitals, right? When you recognize that hospitals in the United States were segregated until 1965 with the Medicare-Medicaid Act passage, right? And that most of those hospitals were built to be in communities not to serve Black communities, right? Then you're wondering, why are African Americans getting harder time getting tested, right? These are the results of decisions and policies that have been made in the past. And so when we sat down with the governor, the question is, okay, how are we going to prioritize making sure that our African American communities can get tested, right? And so that is what we're excited to be happening now.
And it's a great example for people to understand how, structural inequality over time can lead to a result that's not, somebody's personal prejudice or somebody doesn't like you, but this is the end result, as you say, of many decisions, and this is how it manifests in the middle of a pandemic and a crisis. So that people can understand, I think one of the things I'm hearing a lot is, African Americans are not respecting social distancing, and that's why we're getting sick. And that's not my observation. I walk around South LA, and I know that's not a scientific study, but I see people with masks. I see brothers sitting on corners talking to each other from across the street. It's very quiet at night around here. And so my observation is that perhaps this is about, in some ways blaming the victim by saying it's our fault that we have these higher outcomes.
Yeah, and we also have to recognize, so a couple of things. I think that the one thing I will say about that is that I think that it's really important for us within communities to be sharing and spreading that message about how important social distancing is, right? Because particularly in the Black community, where we recognize that, in the history of this nation, sometimes our medical community didn't treat Black people so well, right? I don't know a Black person who's not familiar with the history of mistreatment of African Americans by our healthcare system. And that is not to say that the healthcare system isn't working very, very, very hard right now to provide the best quality care to African Americans. But what it is to say is that when we sometimes hear that there may not be as much trust, especially in our seniors, sometimes from our elders, in some of our healthcare institutions, we have to recognize how important it is for us, right, to be getting the message out around how important it is to be social distancing. We have to be, sharing that information with our neighbors and our girlfriends and our cousins and everyone else, because we're also, in our messaging, we also have to overcome some of that history, right?
Yeah, I mean, it's most of us, kind of have whatever you want to call it, Tuskegee skepticism, if you want to call it that. And so I think that's absolutely true. I even hear a lot of people saying, well, there is no virus, or it's not really a thing. We're being tricked. And I think it comes from that, if you say this history of mistrust, but that in the present day, that can actually be really dangerous.
Yeah, and let me just say, when we say history of mistrust, I mean, we can talk about Tuskegee, but I think, frankly, for me, when I came into my role as California's first Surgeon General, I started my time with a listening tour, and I went around to our communities, and I sat down, and I had conversations, and I listened. And I will tell you, I don't know almost a single Black person who hasn't had a bad experience in healthcare at some point. Like, we can talk about Tuskegee, but Tuskegee was a long time ago. That was like sanctioned, right?
Yes.
But everybody's had an experience of going into a clinic, and listen, there are, really unfortunate and regrettable situations that happen in every field, in every industry, right? We have a long way to go in our country when it comes to dealing with issues of race. But in healthcare, it's all the more egregious, right? Because as healthcare practitioners, we swear an oath. And so what that is to say that when we're talking about experiences that the African-American communities have, we don't have to go all the way back to Tuskegee. We also have to recognize that there are still in the present day, there are a lot of issues that people are wrestling with. But these rumors and this narrative that, hey, this is made up, it doesn't affect Black people don't get coronavirus, right? I just want to be clear right now. That only hurts Black people. I just want to be clear. And not only does it only hurt Black people, it means, if Black people believe that Black people don't get coronavirus, that means we're not getting tested, right? That means that we're not doing the things to protect our communities and our neighbors. And that's why those types of rumors are damaging. It breaks my heart to hear them circulating or to watch some of the stuff that comes out on social media and see those statements go unchallenged. And that's why it's really important for me as our state Surgeon General to say, to set the record straight, to say, I can't tell you how important it is to me, right, that these numbers here in California do not get worse, right, in terms of we're already seeing disparities in terms of the death rate from COVID in our African-American communities. Fortunately, it's not as bad as it is in Detroit or some other places, right? But we all, I am so passionate about making sure that we are all part of that solution in protecting our brothers and sisters.
Yeah, that's a great point. I mean, we're not Louisiana, and we, in that sense, that we don't want to get there. You talking about the big picture about, how African Americans are more impacted. We started out talking about these adverse childhood experiences. Explain, if you would, what you mean by ACEs, and explain some of the things, because you have some step-by-step things that we can do now to help us not just overcome the adverse effects of that childhood trauma, but also to help us build up our immune system in the middle of a pandemic where we need to be as strong as we possibly can.
Yeah, that's exactly right. So when we talk about adverse childhood experiences, that comes from research that was done by the CDC and Kaiser Permanente now 20 years ago. And what they did was that they looked at the effect of 10 categories of adversity in childhood. These include physical, emotional, and sexual abuse, physical and emotional neglect, or growing up in a household where a parent was mentally ill, substance dependent, incarcerated, where there was parental separation or divorce, or domestic violence. So those were the 10. And what they found was, number one, those things were really common. 2/3 of people had experienced at least one, and 1 in 8 folks had 4 or more of these adverse childhood experiences. And this wasn't what, okay? This was Kaiser, San Diego. Their population was 70% Caucasian, 70% college educated. Wow. Yeah. So this is common. But the second thing that they found was that there was what they call a dose-response relationship between these adverse childhood experiences, these ACEs, and not just the stuff that you would expect, right? So increased risk of mental health problems like depression or suicidality. That they definitely saw. Very strong relationship there. Not just the stuff that you would expect in terms of behavioral challenges, increased risk of, substance dependence, but also increased risk of stuff like heart disease, stroke, cancer, kidney disease, asthma, autoimmune disease. And so it turns out that when you have repeated activation of the stress response, and especially in childhood, that can lead to an overactivity of the stress response, something that we call the toxic stress response, where, your stress response gets activated and it's hard to turn it off. And as a result of that, you can see long-term changes to the brain and body.
Surgeon General Dr. Nadine Burke Harris of the state of California, thank you so much for being with us this morning. If you want, credible information, if you want to follow up on some of the resources the Surgeon General was talking about, you could go to covid19.ca.gov, covid19.ca.gov. We'll continue. We're taking your phone calls. We've got Dr. Robert K. Ross and Melina Abdullah from Black Lives Matter coming up next. It is the Front Page Saturday Town Hall Edition, brought to you by the Independent Professionals Association, the City of Los Angeles Community Build, and Council President Emeritus Herb Wesson Jr. Radio Free 102.3 KJL.